Thank you, Mr. Speaker. Rising against this, I'm really struggling to understand the priorities of this particular bill. I think it's a bad bill for a number of reasons. To me, I'm trying to draw a conclusion, some way to just make this make sense to me, some way for me to take it inside and understand it. What I understand about this bill is that if a young man goes to a hospital because he gets a severe laceration on his arm, and that young man has a profound disability, perhaps should be in an RHC or some other sort of community care, but that community care doesn't exist, that young man is going to stay in that hospital room. And he's going to stay there, and he's going to stay there. And the state is not going to reimburse for that young man. In fact, the hospital is going to be asked to eat that. And they're going to be asked to eat it over and over again across a plurality of situations that exist across the state right now. What I'm describing to you is not a one-off situation or a hypothetical, Mr. Speaker. I'd like to read a very short story, and it's entirely relevant.
Please proceed.
Thank you. This comes from testimony that we heard in one of our committees. I'm a nurse in the only hospital in Whatcom County. As a nurse, I see and hear often how the severely disabled with behavioral issues are left in hospitals all around Washington state by DDA. These disabled adults and children are placed in hospital rooms for months, and in some cases even more than a year at a time. Hospitals do not have resources to assist these mentally disabled patients with behavioral issues and can only use physical and chemical restraints to help them. Mr. Speaker, we are using hospitals right now as a backstop for primary care, as a backstop for this really complex care. And what this is proposing is to take what little support we're providing in the state, because the community-based support doesn't exist, and we're kneecapping it, we're taking it off, and we're calling it responsible budgeting. Mr. Speaker, a budget's about priorities. This is not responsible budgeting. This is irresponsible and going after the very people we should be taking care of in this state. We're trying to eliminate healthcare systems through this bill. Mr. Speaker, vote against this if you want to continue to provide healthcare. Vote against this if you care about disabled kids in our community. Vote against this if you believe in responsible budgeting. Thank you.